Hi, my name is Allison Short, and I'm doing this presentation on my dad, Ken Short. And he was seeking help because he had extreme pain in his knee, and so he went to a few doctors and specialists just to see what they would recommend. So we ended up going to a knee specialist to see what he had to say, and then he recommended a specific surgeon. So then my dad decided to go through with the surgery, and he set up an appointment, and he got ready, to go into surgery. Now, before his surgery, the way that he prepared was that he couldn't have aspirin for 2 weeks beforehand because then that would make the blood a lot thinner, and so then it would be pretty bad. And so he could also not eat or drink right before the surgery, and then he had pre-testing before where he got blood work, he got his blood pressure and other vitals done, and then he got a few x-rays of his knees just so the surgeon would know what he was going into beforehand. So my dad started off with going into the hospital, and he met with the receptionist to find out where he had to go for the surgery and for his room. And then he met up actually with someone, a financial person, and so he told him about the costs that he's going to have to pay and went through all the insurance process. And then he went up with a nurse, and she prepared him for surgery and got him ready, took all his vitals, and you know, just prepped him. And then he went into surgery, and in there was the orthopedic surgeon and then a few surgical nurses and aides, and they did his knee replacement surgery. And then after, he routinely for 2 days he was in the hospital, and he got met with nurses aides, nurses, a physician, and then he also saw a physical therapist and an occupational therapist once a day. And then that continued after the surgery, and I'll go further into that. So a knee replacement surgery, he got a total replacement. So the surgeon had to make precise measurements, and that was because he had to remove all of the diseased portions from the bone, and then he had to shape the rest of the bone around it just so that it could fit the new implant. And the way that they make the implant is that they build it one piece at a time so that it's precise and that it will work properly. And after, they would bend and flex the knee to see if it would work and if it was put in properly, or else they would have to redo it again. So after surgery and after he was out of the hospital, he started to have physical therapy, and so he went for 2 months, but then for 2 weeks, the physical therapist came into our house, and they helped with stretching and bending his knee and getting the exercises that he needed to do to build and strengthen it. And so then he also visited with an occupational therapist who also came into our house for 2 weeks, and they helped him get ready to go back into work and to have the proper skills in order to do that effectively. And then he also has received regular checkups with the knee specialist and also his doctor for a whole year after his surgery. So when I asked my dad how his experience was, and he said it was very favorable, and he enjoyed talking and laughing with his nurses aides because he likes to make friends with basically everyone that he meets. And he said that the healthcare team was very helpful, and he did think that some of the transitions between the nurses at night especially was awkward, and that some of the nurses he didn't really get along as well with, but it was still an effective healthcare team for him. He thought that the communications was very effective and that there weren't any gaps, and he also believed that he understood all the information. He knew what he had to do before surgery, after surgery, and he thought it was very effective the way that they spoke with him and relayed the information. Personally, I believe that this healthcare team was very effective in the information that they relayed to my dad, and I think that he understood what he had to know as well. And the only improvement I would make would be a better transition between the nurses, just so that it isn't as awkward and it's an easier experience for the patient.